Jeff Dunn is my name, and I am the President-elect of the Union for International Cancer Control. And today it is my great pleasure to introduce to you the 6 outstanding individuals who have been shortlisted to receive the UICC Award for an outstanding contribution to cancer control. But before I introduce these 6 individuals to you, I'd like to share a few moments about the idea behind the award and some of its history. Building on the success of the UICC member awards in 2018 at the World Cancer Leaders Summit, the UICC and its board of directors decided to launch a new distinction, a new award to recognise and celebrate outstanding work of individuals whose efforts have contributed to advancing cancer care and control globally. The first award in 2019 was given to His Excellency Dr. Tabaré Vázquez, former president of Uruguay, who very sadly passed away the following year in 2020 from the consequences of a long battle against lung cancer. We at the UICC and our members around the world would like to pay tribute to a great champion for cancer control. President Tabaré Vázquez, who had a tremendously positive impact across the cancer continuum from risk factors, reduction, screening, and palliative care coverage. We thank again President Vázquez for his contribution and his legacy. For the second iteration of the awards in 2021, the board of the UICC decided to create 2 categories in order to recognise 2 different profiles of cancer control organisation achievement and activity. The first of these is the policymakers category, and the second is the civil society category. The nominees in the policymaker category must currently work in government, be responsible for setting a country's policies impacting national cancer control, whether directly or indirectly. The nominees in the civil society category must currently work in the broader global health and or cancer community, whether in international organisations, academia, business, or not-for-profit organisations. The focus of both awards is aligned with the summit's theme, which in this year is driving innovation to advance cancer control equitably. Never a more timely opportunity to consider that theme. So without further ado, let me now say a few words about each of our outstanding individual shortlisted candidates. And the first of these categories we'll look at is the policymakers category. And the first candidate I'd like to talk to you about is President Joe Biden, President of the United States of America. President Joe Biden is a strong cancer advocate. In 2015, his son, Beau Biden, passed away after battling brain cancer. Beau's fight with cancer inspires the mission of President Biden's life, which is ending cancer as we know it. Since the launch of the White House Moonshot, President Biden, the Cancer Moonshot Task Force, and the Blue Ribbon panel of experts have engaged thousands of cancer patients and their caregivers, clinicians, health organisations, advocacy groups, researchers, technologists, industry leaders, and more across America in support of achieving a bold mission. The President has brought a new urgency to the federal government efforts to fight cancer and forged new partnerships and created new programs and new policies. Individuals and organisations throughout the private sector have stepped up to the change and to the challenge and have made differences throughout the world. In October 2016, then President Joe Biden delivered the Cancer Moonshot Report, a summary of work to date with a roadmap for the future. And this was presented to the President and the American public. The report includes the Vice President's executive report, his vision for transforming cancer research and care systems, the Cancer Moonshot Task Force report, outlining federal agency activities and recommendations for dramatically accelerating progress, and the Cancer Moonshot Blue Ribbon report, which identifies priority areas of scientific opportunity. In December 2016, the US Congress passed the 21st Century Cures Act, which authorised $1.8 billion in funding for cancer moonshot over the next 7 years. And even though it's only halfway through, it is well on its way to producing meaningful improvements for people with cancer. Supporters heralded the Cancer Moonshot as an enormous, once-in-a-lifetime opportunity for the cancer community and the US nation to come together around a single disease that touches everyone. As Vice President to President Obama, Joe Biden also secured passage of the Affordable Care Act, which reduced the number of uninsured Americans by 20 million by the time they left office, and banned insurance companies from denying coverage due to pre-existing conditions. Our first nominee, President Joe Biden. The second shortlisted nominee in the policymakers category is Minister Greg Hunt, Minister for Health and Aged Care in Australia. In January 2017, Greg Hunt was appointed Minister for Health in Australia. He's always had a strong connection to the medical profession. His mother was a nurse, his wife is a nurse, and Minister Hunt will use this background and has used this background in industry, innovation and science to build Australia's track record for medical breakthroughs, turning what is done in the laboratory in experiments into better healthcare for patients around the country and indeed around the world. Mental health is an issue that is particularly important to Minister Hunt. He is a strong advocate for greater understanding and community awareness in relation to mental health and works to ensure the necessary resources available to assist with this very important issue, particularly with cancer patients where we know mental health and ongoing psychological distress can be a serious issue. Minister Hunt has shown outstanding leadership as a policymaker. In Australia and globally, across the entire cancer continuum, from screening to survivorship and end-of-life care. In 2017, Australia became the first country to shift cervical screening based on HPV testing, which in combination with vaccination and cervical cancer treatment puts Australia on a path to the elimination of cancer of the cervix by 2035. As Minister for Health during this development and transition, Minister Hunt is ultimately responsible for the implementation and has supported multiple key actions and parallel strategies in research and policy implementation to ensure Australia achieves this goal. Minister Hunt champions equity of outcomes for all Australians when it comes to cancer by large government investment into areas such as brain cancer, rare cancer and genomics, ensuring all benefit equally from the developments of technology and translation. Minister Hunt champions new areas of treatment with the establishment of the Sydney Comprehensive Children's Cancer Centre and the National Centre for Cellular Immunotherapy, among others. He is a passionate advocate against smoking and improving outcomes against lung cancer. Recently establishing an inquiry into lung cancer screening in Australia, which has recommended screening and banning nicotine vaping without prescription. He is committed to putting the patient at the centre of the cancer control continuum and has most recently has funded the development of the National Cancer Australia Plan. Our second nominee in the policymaker category, Minister Greg Hunt. Our third nominee, our third finalist in the policymaker category is His Excellency President Paul Kagame, President of the Republic of Rwanda. President Kagame's story begins in 1990 as commander of the forces of the Rwandan Patriotic Front. He led the struggle to liberate Rwanda. And the hallmarks of President Kagame's administration are peace and reconciliation, women's empowerment, promotion of investment and entrepreneurship, and access to information technology. Of course, he also champions as co-chair of the Broadband Commission for Sustainable Development. Under His Excellency President Kagame's leadership, the healthcare system in Rwanda has recognised the necessity of providing critical screening, treatment and care services for cancer patients, as the burden of cancer care continues to increase in his country and in the region. Despite Rwanda's lower than average GDP per capita, the treatment that is often considered too expensive for low-income countries is provided in Rwanda. President Kagame has played an instrumental role in promoting access to diagnostics, as well as in fostering the demand and supply of vaccine, noting Rwanda's achievement of 93% coverage for HPV vaccination for girls as testament to his commitment to preventing suffering from cancer. It is also proof of his ability to coordinate various sectors within the country, including health, education, security, with the betterment of health at the centre of his agenda. President Kagame's equity-focused leadership led to the establishment of the first African Cancer Centre located in a rural area to provide quality cancer care to those most likely to be underserved. The Butaro Cancer Centre for Excellence serves not only the rural Rwandans seeking cancer treatment, but also patients in neighbouring countries who lack access to such care in their own communities. Under his leadership, the government contributes a salary of 75% of the centre staff, thereby investing in the capacity of the centre to provide quality cancer care. President Kagame has also tirelessly supported the creation, growth and advancement of cancer care facilities in Rwanda. He recently inaugurated the Rwanda Cancer Care Centre at the Rwanda Military Hospital to increase access to the full spectrum of cancer care, including radiation therapy and chemotherapy. Aligning with this, his vision of ownership and self-sufficiency, this facility will significantly reduce the cost of medical expatriation and allow patients to receive care closer to their families. President Kagame continues to partner with various external institutions to further build Rwanda's technical and financial capacity to build care. President Kagame's equity-centred leadership is reflected in his work to provide accessible cancer care to all. Under his leadership, the Ministry of Health has worked to ensure that the health insurance reimbursements for cancer care. This approach is critical to ensuring that Rwandan population can access cancer services with a reduced financial hardship. Our third finalist in the public policy award category. And now for our second category, civil society, where again, we have three outstanding finalists. The first of these is Myra Khalifi, breast surgeon and founder of FAMAMA. Dr. Khalifi is a dedicated breast surgeon and an academic with over 30 years experience and numerous publications and manuscripts to her credit. Her main interest is in breast health in underserved populations, particularly in developing countries, and she coordinates a 2-year surgical oncology residency with a multidisciplinary team of over 40 specialists. In 1993, Dr. Khalifi founded a not-for-profit organisation, Imama, and together with patients and health professionals, maintains a focus on education and physical and emotional rehabilitation. In July 2006, Dr. Khalifi then founded the Brazilian Federation of Philanthropic Institutions for Breast Health Support and Advocacy, FAMAMA, a network of 74 groups of patient institutions focusing on advocacy towards early breast cancer diagnosis and adequate treatment. FAMAMA's mission is to influence national public policies to ensure universality, integration, and equity, guaranteeing healthcare coverage for all. Under her leadership, FAMAMA was influential in passing several bills, including the mammography law, the 60-day law, a maximum time from diagnosis to treatment, and a 30-day law for diagnosis, promoting a positive impact on cancer care in Brazil. Currently, Dr. Khalifi is chair of the executive committee of the City Cancer Challenge, Porto Alegre, Brazil, a consultant for WHO Global Breast Care Initiative, and the local leader of the Integrated Cancer Control Initiative in Latin America in Brazil. Dr. Khalifi served as a UICC board member from 2012 to 2018, and she served with distinction. Dr. Khalifi holds degrees in pharmacy and medicine, residency in gynecology, surgical oncology by Guy's Hospital in London, a PhD at the University of London, and has undertaken postdoctoral studies in molecular biology and genetics and cancer at Vanderbilt University in the United States of America. Dr. Khalifi in the last 12 months has worked as a strong advocate together with the 74 Famama associates to establish routine screening and early detection programs in Brazil, as more than 1 million women did not come for the annual examinations. Our first finalist in the civil society category, Dr. Myra Khalifi. Our second finalist is Paul Farmer, co-founder and chief strategist, Partners in Health. A medical anthropologist and physician, Paul has dedicated his life to improving healthcare for the world's poorest people. He is co-founder and chief strategist of Partners in Health, an international non-profit organisation that since 1987 has provided direct healthcare services and undertaken research and advocacy activities on behalf of those who are sick and living in poverty. Dr. Farmer and his colleagues in the US and abroad have pioneered novel community-based treatment strategies that demonstrate the delivery of high-quality healthcare in resource-poor settings. Dr. Farmer holds an MD and a PhD from Harvard University, where he's professor and chair of the Department of Global Health and Social Medicine at Harvard Medical School. He is also chief of the Division of Global Health Equity at Bingham and Women's Hospital in Boston. Dr. Farmer has written extensively on health, on human rights, and the consequences of social inequity. He is a recipient of numerous honours, including the Margaret Mead Award from the American Anthropological Association, the Outstanding International Physician Award from the American Medical Association, a John D. and Catherine D. MacArthur Foundation Fellowship, and with his Partners in Health colleagues, the Hilton Humanitarian Prize. He is a member of the National Academy of Medicine and of the American Academy of Arts and Sciences. His most recent book is Fevers, Feuds and Diamonds, Ebola and the Ravages of History. Our second finalist in the civil society category, Paul Farmer. Our third finalist in this category is Pat Garcia Gonzalez, Chief Executive Officer, the Max Foundation. For more than 20 years, Pat, as the Chief Executive Officer of the Max Foundation, has been dedicated to improving the lives of cancer survivors around the world. A native of Argentina, Pat has a master's degree from the University of Washington and a technical degree in nursing. Pat is the co-founder of the Max Foundation, established in 1997 in honour of her stepson, Max. Max was diagnosed with chronic myeloid leukemia at the age of 14. He survived until the age of 17, and his legacy lives on in the hearts of thousands of cancer survivors whose lives have been touched by the good work of the Max Foundation. Under Pat's direction, since 2005, the Max Foundation is dedicated to accelerating health equity by increasing global access to treatment. The organisation channels over 10 million doses of life-saving cancer treatments to patients each year in 72 low and middle-income countries. The organisation carries out its daily work in partnership with a global network of more than 500 physicians, 200 hospitals and medical institutions, as well as several local NGOs and patient associations. Pat is an advisor to the CML Advocates Network, the International CML Foundation, and is on the board of the Partnerships for Quality Medical Donations. As recognition, Pat has been honoured with several awards, including the CEO Award from the Union for International Cancer Control, the Distinguished Golden Tennis Shoe Award from United States Senator Patty Murray, First National Cancer Institute Global Cancer Medicine Humanitarian Award, and the inaugural Emerging Region Support and Partnership Prize by the International CML Foundation for her role in leading the Max Foundation, as well as her personal commitment to helping people around the world face cancer with dignity and with hope. Our third finalist in the civil society category, Pat Garcia Gonzalez from the Max Foundation. So there you have it, 6 outstanding finalists across our 2 categories. The choice will not be easy. And no matter what the outcome, on behalf of the UICC and all our members, to each and every one of the finalists, thank you for your contribution to cancer control. We do appreciate it. And doesn't it demonstrate to each of us the quality of leadership we have around the world, whether it's in policy making or in civil society, where you're in good hands. To our 6 finalists, all the very best. We had hoped to be able to gather in person this year at the World Cancer Leaders Summit. Unfortunately, we couldn't do it last year. And unfortunately, this year, because of ongoing COVID-related restrictions, we will not be able to gather in person. But the World Cancer Leaders Summit is going ahead. It is happening virtually. And the award ceremony will take place live virtually through the platform on Tuesday, the 26th of October. And we count on you, each and every one of you, to tune in, to be there, to be a part of it. Congratulate all 6 of our finalists and celebrate the success of the 2 winners. On behalf of the UICC, can I just thank each and every one of you for your interest in our work, for your contribution to cancer control, and to thank you in advance for your ongoing support of our mission in controlling cancer around the world. We look forward to you joining us at the World Cancer Leaders Summit. Thank you, one and all.